Hey, hi everyone. My name is Moonshine, and I'm the host of today's AMA with Rejuve AI. Hoping I'm correctly pronouncing that. So, Rejuve AI is going to be a very interesting utility to talk about because it's just not the regular traditional meme tokens and you know all of that we always see in the space. It is a decentralized network that plans to reunite researchers, clinics, data enthusiasts to combat aging through advanced AI technology. I think something very interesting is also the longevity app they plan to establish, and through that you can earn RJV tokens. So these are just one of a few things we're going to dive into details throughout this AMA. It's going to be a very interactive sections. So guys, let us join Zoli as she dive us into through all of these things I've just mentioned. But to start with, Zoli, could you kindly introduce yourself, and you could also, introduce other teammates who we may not be speaking to in today's AMA, and just walk us through the history and how you guys started Rejuve AI.
Sure. Thanks, Moonshine, and everyone for having me here. My name is Jasmine, or Zali on Telegram. Beginnings of it are actually from a larger ecosystem called SingularityNet, which is now the ASI Alliance, and it's all about making AI and eventually artificial general intelligence (AGI) as well beneficial to all of humanity, and having kind of this participatory network and framework for everyone to develop it together instead of it only being developed by kind of big tech companies. And so the first way to do that is by having one of AI's first goals, make people live longer. And so that's where Rejuve comes in. My background is originally in health information management. So I was working for a major hospital system prior to getting into crypto and all this kind of thing, and got involved with Rejuve about 3 years ago, first as a product manager and then CEO. And then we had our token launch in March of 2023 and built out our team and accelerated our development on our longevity app. We did a open beta version of the app for the past couple of years. We've gotten lots of feedback and over 4,000 beta testers. We did a full redesign. We've been building our AI models that are going to be running in there, and now we are preparing for our product launch. And app will be available on both iOS and Android, so Google and Apple Play stores. And as mentioned, it's all about tracking your personal health data and earning token rewards, which you can then use in our in-app rewards ecosystem in exchange for health products and services like supplements, different biological age tests, wearables, consultations, even travel. Already a few of our partner vendors are already accepting RJV as payments. One of those is Trivala, which is like a major travel network, so you can book flights, hotels, accommodation. Another one is called Peptide Bioregulator. So the peptides are like a kind of longevity supplement that are gaining in popularity. And another is GlycanAge, which is a unique type of biological age test. And we have many more that we are onboarding as well.
Very interesting. I think it's very, very interesting to see that you guys have already advanced to reward use case, like reward utilities. That's a very interesting part. I must commend your team. So I think the very first question I want to ask is how Rejuve AI combines AI with longevity research. I think it's something very intriguing. So I want to know what key advancements in AI-driven biomarker discovery or predictive longevity modeling set your approach apart from the traditional gerontology research that we have?
So one of the key ways that we're doing that is by having an international data set. So of course there's a few big ones out there that everybody's using, like the NHANES data set from America, the UK Biobank, which, we'll be leveraging those as well. But what we're doing is creating a brand new one. So we're crowdsourcing data from all over the world to be able to create models that are more specific to more types of people as we begin to build it up. We're also using a variety of different techniques in our AI as well. We started developing these models before ChatGPT existed, so it's not just standard, plug in and comment on things. It's actually doing real deep statistical modeling based on a bunch of different scientific papers and meta-analyses and various different modes of data like wearables, blood tests, lifestyle data, and then eventually we'll integrate the genomics as well. So the idea is to combine as many different types of health data as possible and make better and better personalized insights and recommendations, and also be able to track the effects of different experimental interventions that people are doing as well as those kind of come along.
I think that's very, very interesting because that leads to my second question, because most longevity projects focus on these rejuvenation, senescence, and epigenetics. So if you could explain in details, how does Rejuve AI's research intersect within these fields, and what unique contributions do you guys aim to make within this field?
Yeah, so we do have the same or similar focuses as well. So if you check out our longevity app, we have hallmarks of aging in there, and we have kind of these different categorizations of all these the biomarkers that kind of fitting into those. And the idea is to be able to make better and better predictions and aggregate that type of data. So yeah, we're basically doing that by collecting over 370 different biomarkers, and those range from a variety of survey-based questions, a variety of blood test questions, and the wearables data like that you can get from your smartwatches or even your phone, like sleep, steps, heart rate variability, all those type of things. So yeah, it is still very much following the core ethos of aging science, but really just the innovation is being able to combine that from various different people to be able to plug in their own data and know exactly that they are contributing to this body of work, and being able to get personalized feedback and earn rewards for contributing to the science as well, and bringing that educational content more to the user level. Instead of it being really abstract, it's like connecting it to your own personal health and wellness on a day-to-day basis.
Very interesting. And just because we are still, on this topic, and I don't know, what the things you say just lead me on to the next thing I want to ask you. And that is, I'm very strong on peer-reviewed research when it comes to longevity science. So, in the past, we've had longevity science facing skepticism due to exaggerated claims in the past. So how does Rejuve AI ensure its findings are scientifically rigorous and backed by peer-reviewed research?
So our initial model that we're using is called Bayes Expert, and it's a Bayesian network that's actually utilizing statistics from meta-analysis, and meta-analysis are one of the highest standards of peer-reviewed scientific articles, because what it does is it aggregates the results of thousands of clinical trials and kind of makes an analysis of them. So we use a bunch of those. And so then the next step from the data that we're collecting from our users is most focused on N of 1. Now, of course, there's kind of not a standard for that just yet, but that's why we're aiming to be able to utilize that data better. There's a lot of people out there, which they call biohackers, or even just people that are health and wellness enthusiasts that are, just doing different protocols that work for them, but they're not tracking it in any kind of standardized way that can be scalable and for everyone else. So that's really what we're trying to do, is get everyone to measure baselines, track more normalized and regularly what they've actually done, and then measure again, and be able to aggregate those results across each other to be able to identify patterns using AI to be able to add to the increasing body of knowledge. And on the other side of the products that we're kind of displaying. We do vet our partners to make sure that they are also scientifically rigorous and sourcing quality ingredients and, kind of industry standard tests and whatnot. So we have a lot of trusted names on there, and you can see that on our website as well. And yeah, so that's pretty much the gist of it, of just maintaining the high quality and having the transparency of everything that the data that we're using and how we're doing it and what we're intending.
Interesting. I just want to appreciate the fact that you acknowledge that there's many, scientific research that are not backed up by this peer-reviewed research, and they just want to do their own thing based on their expertise, which is very, very not okay. So to see you guys have partners and even team members who are experts in certain fields is something I must commend you guys about. So I think the next question I want to ask is, how does Rejuve AI model analyze and personalize longevity recommendations for users? Are there specific machine learning techniques that are particularly effective for you guys?
So in this, the beta stage has all been about, getting everything to work. So we can't say that there's any results from that data because we're having a formal program that people are joining. So once we go live, we have something called the data NFT. And that is kind of your identity token and permission gateway of how you participate in our network and tracking all of the contributions that you have made to the algorithms or to any research. And once that kind of goes live, and we also be having a IRB review as well, then that's when the research stage formally begins. And the techniques that we'll be using, as mentioned, is the Bayesian network. We're using variational autoencoders and a mixture of experts. So you might have heard of this type of modeling before, where basically you take a bunch of generative models and tie them together and make them kind of talk to each other and specialize on the type of data that they're best at, and then inform each other on this holistic result. And our goal is to make mechanistic simulations based on systems biology, starting with the single cell and going up from there. And yeah, that's the method that we're going to use in order to make the personalized recommendations and discover more about other factors too. Now, of course, on the recommendation side, a lot of it is at this point kind of common knowledge. Like, everybody knows what you should and shouldn't do health-wise, but it's more about how to actually make it actionable in your own life and situation, and what areas that are most important for you to focus on first and primary to make sure that you can live the longest, and then finding out what new technologies down the pipeline could be applicable, and gaining the data from people who are earlier adopters to be able to apply it to people who are a little bit more risk averse, and until it's kind of safer and proven.
Nice. Thank you for that answer. So I think the next question I wanted to ask was, you explaining how the AI model integrates multi-omics data, like when you want to talk about the microbiome data, genomics, proteomics, and all of that to create personalized longevity insight. And when you talk about this microbiome data, you find out that not many people have detailed knowledge about, these multi-omics. And so I just want to know, is this just like a suggestion if it's something you guys don't have imputed in your project, like having videos? It could be very short videos about, the diversity of these microbiomes and how it affects the health, the balance it brings. Many people, when they hear about microbiomes, they feel it's just something very bad that shouldn't be in their system. They don't have the knowledge that it is standard in everybody's system. Is when it becomes high in diversity that it brings about certain errors and dysfunction in the body. So having these short videos, videos tend to have a very long-lasting effect in the minds of people. I feel that would be something special that Rejuve will be having that would attract people to want to watch and, be interested in what you guys have to offer.
Yeah, for sure. I mean, we have like a few of them, including one that's in the app as well, and we have a lot of content kind of planned, and we also make a lot of blog posts too to kind of break down these complex concepts in a simpler way, so that it is a big part of Rejuve Network, as well as being able to bring that educational level both to individuals, the common people, but then also on the clinical side too, because we believe that longevity should not be something that is only a special niche thing, but that it should be part of basic healthcare. So therefore, everybody should, understand what these things are. Yeah, understand what microbiome actually means. Having gut bacteria diversity. Understanding what cellular senescence is, and all these different terminologies. So we do create quite a lot of content around that, and the goal is to really bring up the education level and familiarity with it.
That's quite interesting. And your app is a sight to see, actually. I forgot to mention that. Yeah, to see that app and you guys have incorporated this is something nice. So now let's move to the blockchain aspect of this. Now you guys are going to see or meet critics that are going to argue the blockchain just adds unnecessary complexity to health tech solutions. And you guys kind of have kept it very simple. So why is blockchain a fundamental piece of the Rejuve AI ecosystem rather than just just a nice to have feature, just something to make it very catchy for people to see?
So the blockchain technology itself is continuing to develop. Like now, we're at the point where people don't even really have to have this big long seed phrase to create a wallet. So that problem's finally solved. So that's exciting. But on the infrastructural level, there's so much that you can do as far as interoperability of data sharing. So that's kind of the main thing, is that, once it is robust enough to actually store large volumes of data on chain, that problem will be solved. Right now, we're still using kind of more centralized data storage, but the tracking record of who has accessed the file, that's on chain, and that can be that assists with data ownership. On the incentive side, sure, you can argue that you can use local currencies and whatnot, but then that limits the global collaboration aspect. By using cryptocurrencies, digital currencies, we can truly involve people from all countries in the world, or at least all the ones where it's legal, which that's becoming more and more true every day, to be able to have a more participatory environment than limiting to just dollars and rubles and whatever else the currencies that people have. There's a lot of I think Web3 and blockchain technologies have so much great potential, and it's only continuing to grow. And then, as mentioned earlier, NFT space as well. NFT started out as just being ownership for artwork and trading memes and things like that, but now it's being used for digital identity and other forms of intellectual property ownership, and that kind of ties directly into what we're doing as well. So it's really just about enhancing collaboration and interoperability of moving data around, and being able to work with it more meaningfully and break up the siloing of data a little more.
Interesting. Now to the next question. How does Rejuve AI ensure that the value generated from user contributed data flows back to the contributors fairly rather than just the platform?
So this part is kind of the initial amounts that we are giving there are kind of just based on our total supply. We had an allocation of a certain percentage of tokens going to data contributors. And we also have another aspect called our ambassador program, which will have a governance group that'll be working on making sure that once that initial supply has run out, that it is able to kind of continue to come back in a more systematic way, instead of like kind of just having to find it. Overall, the idea is that the bounties on the data are based on how useful they are to the algorithms, and that can actually be kind of calculated. So let's say we find that, we can use maybe the microbiome data, for example. We find that this data is really valuable. Then we can put like a higher kind of bounty on collecting that to kind of incentivize people to do that. Or maybe it's some particular blood biomarker that we really want everybody to collect and make sure that it's a validated real test that people took. We can put a higher value on that and then maybe lower on other stuff that is more common. So that's really the idea, is that the value in return is based on how valuable the data is to the AI models, and then also being able to balance it with actually subsidizing the cost of the tests that are needed in order to continue to provide the data on a regular basis.
Yeah, thank you so much for that answer. I really appreciate the transparency you guys are trying to put in play in your ecosystem, but it makes it very, a bit easier for the system to be seamless in terms of, contributors trust the ecosystem they're being involved with. So I think let's go to the Ridgeway AI token. So what are some use cases of the token, and how do you plan to sustain long-term demand for the RJV token beyond just initial hype?
So the main value of it is to, as mentioned, like kind of gain access to the health products and services within our partnership network. We'll also have kind of special features in the app that you can use it for as well, like upgrading to premium subscriptions and enhanced AI reports, personalized plans, and we'll have different kind of features like that, like leaderboards, and there's also kind of something in development as well, like a kind of a gamified feature that we're working on. So really we want our network ecosystem and within the Rejuve Longevity app itself. But mostly the RJV token is meant to be the token of the longevity ecosystem as far as crypto goes. So when you think of any type of wellness, longevity, health enhancing product, what token do you associate it with? RJV. That's kind of where we're going with this one. So anything that is, like I said, it could be a telemedicine consult. It could be a spa retreat, anything that's, kind of meditation things. It could be, the more hard supplements and gene and cell therapies, all that kind of a thing. We just want that token to be the one that ties together this ecosystem.
Very interesting. And I don't know if you feel comfortable sharing maybe success stories where Ridgeway AI insight have positively impacted the user's health and longevity outcome.
Well, I guess as mentioned, like since we've been in beta, we've been using all of the feedback and results to improve the application and make sure that it's actually working up to the standards that we desire. So I think right now it's mostly about the community itself. We have kind of a weekly trivia questions that have to do with health and longevity science, and we have people kind of sharing their tips and routines on what they're doing and kind of encouraging each other on their wellness journey. So I think at this time, that's probably the most impactful, is just people being able to share with each other what they're doing, and also being able to give feedback to help us identify anything that we can improve upon. To make sure that it's easy for people to actually get value out of it. Like, for example, one of the key requests that we get is translation into other languages. So that's something that we've put on our roadmap for very soon after we launch. It'll be one of our top priorities to make sure that it gets out there to more people, and that we can validate that all of the test categories are translated properly, so that we can really reach more and more people and stay true to our message of being accessible and affordable to all.
Yeah, I think that's nice. The aspect of the language is something notable to actually have, considering the fact that Ridgeway AI will not just be limited to one country, but would have the potential to go global. So that's very nice. And okay, so another question I want to ask is, you know, how does Retrieval AI ensure its solutions remain accessible rather than being monopolized by the wealthy? So, and just because of this question I asked, I just wanted to know how affordable is it to subscribe? I think you mentioned some subscription model. You could as well walk us through that, because as times goes on, we know how the economy can be, and things just start getting unnecessarily expensive, and then it gets hard for the average individuals to access these premium information or data or something, and it gets hard for people to actually afford this. And we don't want to forget that we're actually doing this for the whole mass and population. So how are you guys going to target social inequality in terms of what you guys are trying to offer, and not just after material finance and all of that?
Yeah, our first beta testing, so that just seems the most fair that those things kind of remain there. And then what we're going to do is add value on top of that. And the subscription will not be super expensive. It'll be, kind of a normal range, like less than people are paying for a ChatGPT subscription, for example. And we also have all of our partners that are listed in there. Our affiliates. So that's also another kind of stream there to kind of balance it out. And of course, the main thing is that we're offering the token rewards in exchange for the data. So that becomes kind of a circular economy there to assure that everything is kind of balanced and truly accessible. So the goal is not that we're going to just, charge exorbitant fees for things, but rather that we're trying to actually lower the access barriers. Because, for instance, epigenetic tests are fairly expensive just at the outset. So at first, okay, we're offering discounts to our members, via our partnerships. But then, of course, if you have tokens, the idea is that you're making up even more of that cost, maybe even up to 100% with the tokens that you've earned from using the application. So that's really the essence of it, is that people that are logging in every day and contributing data, earning tokens, participating in our network in other ways, staking, participating in ambassador programs, all of our incentives that we have going in our community, that ways to earn RJV, and then being able to use that to actually access the health products and services directly, which allows you to put in more data, earn more, et cetera, and just keep going like that, and keeping the subscription, at a decent level to where, we are able to sustain and grow, but also be affordable to the majority of people.
Okay, thank you so much for that. And I would always want to open the floor for comments and ask some questions. So I have a lot of questions to ask, because you guys have something very great going on, honestly. And just because even in real life, I'm focused in the healthcare aspect, so it's something that really piqued my interest when I saw what you guys were planning to do, or what you guys are already building and have in place. So I think one question I would like to ask before I open the floor to the community is, if you guys have a legal team, because we know the very benefits of these, especially for a project that has healthcare in terms of regulatory compliance, risk management, and liability protection, contracts, patients' rights, ethical consent. All of these things are very important to have a legal team backed up. So do you guys currently have a legal team right now, or is something you guys also plan to incorporate?
Yeah, so we basically work with contracted services for the most part. We do have connections to legal teams, and also we have a integrated compliance partner as well called Drata, and it pretty much allows us to automate these procedures such as GDPR compliance. So we're starting with that standard because that's the highest standard. We've talked to many different auditors and regulators, and they always say, if you're following this, you're following everything else. So yeah, we are constantly monitoring that and making sure that we stay up to date We also have HIPAA on the roadmap as it's needed. We're not currently working directly with any U.S. providers, so it's not needed just yet, but it's available in our suite of things as well. And yeah, we have regular kind of trainings on our team for safety and security, and yep, we're following all the necessary regulations.
Nice. So at this point, let's okay, I think let's just talk about the tokenomic structure, and the supply, how many the total supply of your token. There are any team token allocated, and maybe you could also just move us through if you guys have any marketing plans and then your roadmap. I think we should just wrap that up.
Sure. Yeah. So the tokenomics are all published. I mean, so the TGE was all in March of 2023. So the data is all out there. So actually, next month is the final month of our initial vesting. So everybody that bought tokens back then, the last distributions are going out next month. We had certain allocations for various things. As mentioned, the data contributor rewards was I think 15%. That has not been circulated at all yet because the app hasn't gone live. All the other categories have been used as needed, like such as liquidity. That's one, we use that as needed. Team tokens had a certain allocation, which is public. We have an ecosystem fund. Only a portion of that has been used really to start the ambassador program, which is going pretty well. We've onboarded 2 champion medical advisors and several other divisions of our program, which is pretty cool. You can check out on our site as well. We have KOLs, we have community moderators, we have community task board where people can do small bounties, and we're also aiming to do a clinicians advisory group. We're currently building that now, and that's basically to aggregate all of the physicians, clinicians, anybody working in healthcare that's in the Rejuve community, get them together on a regular basis, maybe every 2 months, to talk about how to promote longevity initiatives in their healthcare practices and in their local communities, and be able to make this more of a standard of care everywhere, being able to integrate the Rejuve app into their practices and communities as well. And what else? Oh yeah, the total supply is 1 billion tokens. We're on 3 different chains, Ethereum, Cardano, and Binance Smart Chain. And then our list of exchanges that we're on is also public as well. And if you have any further questions about how the tokenomics are, there's actually 2 blog posts on our website that are searchable. One of them is called Tokenomics Deep Dive, where I kind of made that one shortly after launch because it was a lot of people make these random websites of when token unlocks, and it's like, oh, this is completely false. Like, you can check the chain and see that this is not what's happening. And so I wrote a really detailed blog post about what all the different divisions were for and how they're used. So that's still out there. And it's actually, according to our stats, still one of the most popular blog posts that people read. So yep, it's there.
All right, thank you so much. So at this junction, let's take some questions from the community. So guys, if you have any question for Rejuve AI team, kindly signify by raising your hands and you'll be unmuted to ask a question. So Mr. Alexandra, you can unmute your mic and ask your question, please.
Could you elaborate on how the platform ensures fair attributions of contributions within the supply chain? And are there blockchain-based mechanisms or smart contracts in place to transparently track and reward individual data contributors?
Yes. So it's called the data NFT. The contract the smart contract is already written and has been audited by Hacken, and that report is available. And we'll be integrating that into the app in our next phase. It's kind of a big project. And basically how that works is there'll be a identity verification that'll be pretty simple, like just a kind of a face scan thing just to prove liveness and that you're a real person and there's only one instance of you that's ever been connected to it. And then we'll mint it for you. So we're covering that cost for everyone to mint their first data NFT. And then that kind of creates hashes based on the data that you are kind of submitting and kind of attesting and signing is legitimate. So you get to kind of check whether or not that's truly the submission that you wish to make to the database, and then it'll be connected via that.
All right. Thank you. Thank you. Thanks.
Thank you.
Mr. Alexander. And so while that question was coming, okay, we have Larry. Larry, you can ask a question, please. Let me see. Give me a moment. So, Larry, you can unmute your mic to ask your question.
Okay, so what encryption or anonymization techniques are implemented to prevent misuse by third parties who purchase the all data informations, especially given the sensitivity of DNA and blood test data?
Yes, actually, we don't sell any of the data, so we are practicing, as mentioned, all of the compliance regulations to where we only give access to data for who really needs it. So when you sign up to our platform, we use email address rather than any sort of personally identifiable factors. Like we don't need to know, real names or addresses or phone numbers or anything of that nature. And then as far as on the data level itself, we're mostly concerned with the raw data. And if any other outside research entity ever did request to use your data, you would have to sign the transaction via the data NFT to say, yes, I want to share my data with XYZ party, and we'll be able to give you all the details about, the research group and what type of study or, trial that they want to do and why they want to use it. And then you get to say, yes, I want to participate in this. And unless you do that, we never release the data from the Rejuve network.
Yeah, thank you so much, Larry, for asking. I think just to throw more light on what he asked, I was trying to go through your website because there was a part of it that I saw about purchase. So I'm just trying to go through it so I can read directly from your website what it says. So that aspect where it says the businesses have to purchase this data, can you throw more light on what you guys are talking about? Because it's more looking like a third party has to purchase the user data or something.
Well, this is kind of a future-facing thing, as mentioned. Like, if this is when the database gets to a certain size. Like, let's say, there's 10,000 active members, which is, a major goal. And all of a sudden, another research group goes, hey, I really would like to do, some kind of study on this data set because it's super valuable. And that's where this program kicks in, where we will present this initiative. Like, I don't know, some university group would like to do a study to figure out, and wants to collect these genomes and this blood test data and from some subset of people. And so we would present that in the app and say, hey, who wants to participate in this? And then you would sign up for it. So it's not that we are just open-endedly sharing out data. The whole point of our platform and a big value statement for us is the data ownership aspect. So in order to participate, the person has to sign on-chain transaction in order to say, yes, they do want to participate, and they will be provided with full details of any entity that does want to access it, and also be showed what type of rewards that they may expect as well, if applicable.
Yeah, thank you so much for that, and thank you, Larry, for training that question because that's a very insightful one. So, okay, I unmuted. Let's go with Ethan. Ethan Jackson, you can ask a question. You have Ethan Jackson, are you there? Okay. While we wait
Can you
for
guys
Ethan.
hear me now?
Okay, yeah, I can hear you. You can ask a question.
Yeah.
Okay, so Rejuve AI is doing something really exciting by AI and blockchain, by using AI and blockchain to, push the boundaries of longevity research. So, with AI advancing so fast, how do you guys make sure your model stays fair? What's the word? Transparent, and keep improving without any biases. And since you're dealing with sensitive data, sensitive health data, how do you strike the right balance between giving users personalized insights while still protecting their privacy as well?
Yes, so that all comes back to following best practices. Now, of course, the safety and integrity of the data set is separate from the insights generation, because we can anonymize and aggregate data and be able to train models without it kind of personally directing back to anyone. Keeping it up to date, that's like kind of just watching the space and getting the feedback from people, and how accurate it was. We're collaborating with the clinicians and scientists as well. And part of the way that we are tackling bias in models is by trying to get more data from more places around the world and not just be limited to certain populations or demographics. So that's something that we're really focused on, and trying to solve that kind of industry-wide problem. And as you mentioned, the acceleration of the space is really a benefit, because our strategy is actually to aggregate models together that are the best in class in processing different data, and create better and better simulations based on them. So therefore, the advancement of the technology is actually a good thing for us, and it opens up more opportunities. And really, it's all about just having the participatory framework and network around it to ensure accountability and high quality at all times.
Okay, thank you for your answer. I just wanted to clarify. That's why I asked.
Thank you.
Yeah, thank you so much, Ethan. So let's have David. David Seed. You can ask a question now. Kindly unmute yourself to ask a question. Hi, David. Are you there? You can unmute yourself to ask a question. I think he's kind of having some network connection or so. Okay, yeah. Ask your question, please.
Okay. Thank you for having me. For my question.
Yeah, I think we lost you there.
Yeah, sound dropped out.
How does the Longevity app leverage the AI service to generate? Oh, can you hear me now? Sorry. Did you get my question?
Please go again with your question.
Okay. My question is, how does the Longevity?
Okay, I think he dropped out again. Did you get
app leverage the AI service to generate personalized insights?
Okay. Okay. Got his question now. I think he's asking, how does the Longevity app leverage these AI services to generate personalized insights? And I think possibly mechanisms that are in place to validate these AI-driven health recommendations.
So yeah, we have two different models that we're starting with. One of them is the Bayesian network that I mentioned that is utilizing the first training data set it used was the NHANES one, and then it also is supplemented with many meta-analysis. It's going to be updated with the user data. Our other model is a biological age calculator from the same data set actually as well. And the idea is that the user data makes the models better and better. So we are kind of doing an initial seeding one. So we are not kind of claiming that the first one is the most advanced or the best one, but it's one that is fairly accurate and supported with scientific data and methodology. And the goal is that we're improving them and making them better and better with this new data set that we are creating in real time.
Does that answer your question, David?
Okay, thank you. Thank you very much.
Thank you.
Thank you. So we have some questions from the Peculiar Stone is asking, do you have laid down plans to integrate with health and wellness apps such as fitness trackers or nutrition planning tools in the future?
Yes, so we already are integrated with several of them, so we can onboard a Apple Health and Apple Watch, Fitbit, Garmin, Oura Ring, MyFitnessPal. So we have like a collection of different plugins that we can continue to add. It's via one. They started to develop these multi-API solutions pretty much to be able to plug in many devices. So this was something that when we first started developing was a big thing that would take a lot of time to do each and every one individually. So now that's not as much of a problem. We can add them on by the users. So if that's there.
Yeah, thank you so much for throwing in that question. So let me try to get maybe one or two. Okay. This one says, how does the Longevity app differentiate itself from other health tracking apps on the market?
I think it's the first of its kind to create combine the AI and blockchain and longevity components all together. There are a few other longevity apps out there. Most of them are kind of just using a chatbot plugin and things of that nature. So we're doing a little bit more than that, and also the fact that we're creating the database as well and kind of the decentralized network around it to really be able to connect together all of these various different entities, like the healthcare providers and the vendors of the products and services, the data contributor, and all of the kind of scientific and algorithmic parts. And really, I think there hasn't been yet an emergent leader in the longevity app space. It's kind of a new playing field right now. So there's lots of room to ascend. And of course, our rewards structure as well, I think is pretty unique.
Interesting. So another question, does the app offer real-time longevity score updates, or does it require periodic recalibration?
There are metrics that update daily, such as if you have your smartwatches and things connected, that will sync. We have daily survey modules that you can use to augment those as well. One of the questions that we get is, why do you have the daily survey if you already have the wearable hooked up? And it's because there's certain subjective measures and qualitative things that you can add to it that are not necessarily connected to your device. So kind of round it out. And then your other health metrics, they're more, you'd have to update them at different intervals. Like, for instance, we have like a long one called general medical history. You probably only need to update that one maybe like once, maybe twice a year, because that stuff's not changing constantly. And then that begins to build, kind of trends and trajectory of how your overall health status is going. So there's a variety of, different types of measures. Some of them, are meant to be daily, and then other ones are meant to be at more intervals, like, every 3 months, every 6 months, things like that.
Okay, another question here from Suki says, can users stake or lock their RJV tokens for additional benefits within the ecosystem?
Yes, so currently our main staking partner is called Singularity DAO, or really they've become Singularity Finance, and they're one of the projects that launched even before us in our ecosystem and have really trusted software for staking and farming. And then on the Cardano side, we're on MinSwap, and we're also looking into more staking solutions on that side as well.
Interesting. So just trying to see another part that hasn't been touched on. So we can just touch on it. And while we look for that, something came to me while we were talking earlier, and I just wanted to just mention it. So basically, we have most of these licensed medical experts or doctors who, we usually have them now even on TikTok, just want to talk about something that would help everyone globally. So would you guys maybe provide a space for after KYC and, scrutinizing what they want to talk about in their video or something, like a space in your platform or your app where, once you log into that section, you just see these licensed doctors and medical experts, and I may choose to follow the one I want to. I don't know if you'd have sort of system, or you just prefer your team who are experts to just cover those video aspects.
So I guess that could be something that could be part of our physicians and clinicians advisory group. If we're talking about like just creating content, like if there are people already in the community that are in those professions, they can take up those roles. I guess like, because I was thinking more like telemedicine consults themselves, because that's something that we are really aiming to have, is that, you can actually consult with a doctor about your personal situation via our app and being in that manner and paying crypto. But yeah, if we're talking about just having clinical advice, I mean, we have like our two medical advisors on the team that regularly do interviews, events, blog posts and that kind of thing. But yeah, we definitely could scale that up with this clinicians advisory group that we are building to be able to do even more of that education type of thing as well.
Nice. And just the last question that came in here from D. D asked, I don't know, are there two tokens like the AGX, AGIX and Ridgeway token? Because it's asking how the AI agent optimize tokenomics by balancing AGX and Ridgeway token incentives for sustainable ecosystem growth.
So the AGIX actually merged two other projects called Fetch and Ocean. So now it's called ASI, and it's like this new alliance, and they're all about building AGI systems. Now, on the original platform concept, yes, we are still, like, our Bayesian net model is connected to the Singularity Net backend and is still using the legacy AGIX tokens for the moment to run its operations in the production environment. It could be switching over to the ASI, but we'll be checking on that once we load in our V2 of our Bayesian net. So yeah, we are still very much intending on continuing to place our in-house models on the Singularity Net marketplace and be able to have those interact with and be available for other people to download and apply to their own data sets as well.
Nice. So Zoli, I think it has been a very lovely interactive with you. You just hit the point on the head. You go straight to the point. I mean, how seamless you are in communicating about Ridgeway AI just shows how insightful and knowledgeable you are about what you guys are building. And I just want to say kudos to you. You're +1 to your team, definitely. So it just drives me in to see how great the other teammates are because of how well you are able to present what you guys are actually building. And I would say with how far you guys have spent and built, I'm sure that the other things you guys have lined up on your roadmap is something you guys would definitely be able to do. And I just hope that once you guys are beginning to cross those milestones and beginning to build those incredible utilities in few months to come, and we hope to have you guys back again at Gold Diggers. So with that, I will be closing down the VC, but I want to give you a chance to just give your final concluding statement, maybe touch on some points we we're able to cover throughout the AMA. So the floor is yours.
Thanks so much, Moonshine. And again, thanks for having me here. It's always nice to get these really insightful and deep questions, because sometimes it can seem, amongst the hype in crypto, like, does anybody even care about real projects, or is it just trading memes and pumping and dumping stuff and, all that kind of thing? So it's always nice to come into new communities and see that, people actually are really thinking deeply about the things that are happening. Of course, the decentralized science, the DeSci space, is beginning to be popular and grow. And I think that that's really going to be where the value in crypto and blockchain is really coming to, is these real world use cases and products, and building new infrastructure for society, and making sure that we can improve upon these old legacy systems that had a lot of these biases and problems of as entities controlling everything. So it's really cool to be a part of this. And yeah, again, just want to plug the ambassador program that we have. We have like 8 different prongs in there. We have the KOLs, we have the governance group, which we want to start up pretty soon. So all of you tokenomics and governance experts and enthusiasts can sign up for that as well. And if same thing with any kind of doctors, nurses, dietitians, nutritionists, all that kind of thing, and our clinicians program. And yes, stay tuned for news about our upcoming app launch and all the other cool, exciting things that we'll be doing.
Yeah, I definitely would want to chat to you all, because I am a biochemist. So this is a field I'm particularly much interested in, and I'm sure that our community are diverse of different aspects, because in the past we have great health projects, and we've really been able, Gold Diggers as a platform has really been able to interact with those projects even in real life. So I'm sure we still have a long-term, association between we and Gold Diggers and you, Retriever AI. So thank you so much. I really want to appreciate and extend these great accolades I'm giving to you, to your team as well. So nice meeting you, Zoli, and thank you all so much for joining. Please, guys, join their socials, see what they have going on, download the app, because that is where you're going to get major updates and about Retriever AI and what they plan coming in the future. So with that, thank you so much, Zoli, once again. Bye. See you guys in the next.
Thank you.